Hello friend, welcome once again in your channel Pharma. In this video we discuss the diagnostic test for different disease. So different disease caused by different agents such as virus, bacteria. For such a disease, diagnostic state needed for screening and detection of the disease. By using a diagnostic state, each and every disease can be cured. So this video is important for as per every exam, and also which is also important for Arogya Vibhag and Jila Parishad pharmacist vacancy question paper, which is also important for as per the point of the view of the GPAT and other competitive exam such as the DI or inspectors and such other competitive exam. Also this point is important. So by using a diagnostic state, every disease can be cured. In that, the different disease caused by different organism, and they can cure by a specific test for each disease. In this video, we discuss the disease, their causative agents, and their test and their control program. So let start with the disease. First one is the tuberculosis. The disease is the tuberculosis, and the diagnostic state which is the Montek skin test. So this test is performed on the skin. In this test, injecting a small amount of a substance called as the PPD tuberculin. So this is the PPD tuberculin, and this small amount of substance injected into the forearm of the skin, and there is a starting of the infection leads to the hard red bump on the skin, so which is indicate that there is the infection of the tuberculosis, and this tuberculosis which caused by the mycobacterium tuberculosis. So for the treatment of tuberculosis, the BCG vaccination also give, and other such other first line, second line, third line, and fourth line drug should be also used for the treatment of such a disease. And this disease which is the control by the revised national tuberculosis control program, which is the RNTCP. So this is a program which control the tuberculosis. Next one is the next disease is the leprosy. So leprosy which is caused by the mycobacterium leprae, and the diagnostic state test for the leprosy which is the lepromin skin test, which is the skin biopsy. So in this test, inject the inactive standardized extract of the inactivated leprosy bacilli. So inactivated leprosy bacilli inject under the skin of the forearm, result in the redness and the swelling and other changes take place on the skin, indicate that the leprosy injection, and which is controlled by the National Leprosy Control Program, which is the established in 1955, which is the renew or change in name that the National Leprosy Eradication Program in the 1982. So next one is the malaria. Next one is the malaria, and malaria which is the caused by a causative organism which is the Plasmodium species, such as the Plasmodium vivax, Plasmodium malaria, Plasmodium ovale, and Plasmodium falciparum. So diagnostic state test which is the CBC test and MP test. So MP test which is the malarial parasite test, and CBC test which is used for the identify the malaria parasite. This test check the anemia. So anemia sometimes develop in people with malaria because parasite damage red blood cell. So by damage the red blood cell, there is a developing anemia, and the CBC test that identify the malarial parasite cause the anemia. So infection which is the and lead to the malaria, and this malaria which is controlled by the National Malarial Control Program, 1953, and national, which is the renew at a national malarial eradication program in 1958. So next one is the influenza. So influenza, which is the flu and caused by the influenza virus. So this is the viral infection of the lungs, nose and throat, and the identification test, which is the rapid influenza diagnostic state test, such as which is the RIDTS. So which is the immunoassay that identify the influenza A and B, and their program, which is the global influenza program 1947. Next one is the dengue, which is the dengue fever, which caused by the mosquito, or which is the borne viral disease occur in a tropical and subtropical areas. And the diagnostic test, which is the troniquint test. So this test is performed to identify the dengue fever, and the program, which is the National Dengue Prevention and Control Program. This program control the dengue fever. Next one is the diphtheria, which is caused by the Corynebacterium diphtheria, which is the serious infection of the nose and throat. So diagnostic test, which is the sick test and ELEX test, which identify the diphtheria infection, and program, which is the universal immunization program. In this program, there is the no single vaccination available for diphtheria, but the vaccination which is the given in the combination, which is the first one is the diphtheria or pertussis plus tetanus toxoid vaccine, which is the given for the control of the diphtheria infection. So next one is the brucellosis disease, which is the mainly spread through the animals to the peoples, and which is the mostly unpasteurized dairy product. So this is the brucellosis, which is the bacterial infection, and the diagnostic test, which is the COM test, and their alternative name is the opsonization test, and their program, which control the brucellosis, which is the National Animal Disease Control Program, which is the NADCP. Next one is the rheumatism. So rheumatism is a chronic disease of the joints, bones, and which deposit the uric acid in the bone and lead to the infection. So for this purpose, the diagnostic test is the Roche water test, which identify the rheumatic factors, and their program, which control the rheumatism, which is the community oriented program for the control of rheumatism disease, which is the COPCORD. This program control the rheumatism. Next one is the pneumonia. Next disease is the pneumonia, and which is the virus or bacterial or fungi, and which mostly caused by the streptococcus pneumonia, and their diagnostic test, which is the gold immunization test, which perform to identification of the pneumonia, and their program, which is the integrated global action plan for the prevention and control of the pneumonia and diarrhea, which is the GAPPD by WHO and UNICEF. So next one is the HIV or AIDS, which is the human immuno virus or acquired immunodeficiency syndrome, which is generally transmitted caused by infected blood or semen or vaginal fluids or sexual transmission with infected partners. So the diagnostic test, which is the ELISA, which is the enzyme link immunosorbent assay, and Western blotting technique, which also used for identification of the HIV and AIDS infection, and the program which control the HIV and AIDS, which is the National AIDS Control Program, which is the NACP, launched in 1992. So under this program, the HIV can be controlled. Next one is the syphilis, the diagnostic test of the syphilis. So syphilis, which is the sexual contact disease, which is the transmitted through the sexual contacts, and the diagnostic test, there are number of the tests to perform for identification of the syphilis or cure of the syphilis. First one is the Warsman test. Next one is the VDRL test, which is the venereal disease research lab test. Next one is the Khan test. Next one is the fluorescent antibody absorb serum test, and last one is the treponema immobilization test. So this test perform for the identification or easily cure of the syphilis. So next one is the typhus fever. So typhus fever is transmitted through the bacteria, fleas, lice, and chiggers. So there is small insects for this typhus fever can be transmitted, and the diagnostic test, which is the Will-Flix test. Next one is the scarlet fever, which diagnostic test is the Dick test. Next one is the Hemophilus, and their diagnostic test is the Ducre test. And next disease, which is the smallpox. So smallpox, which are diagnosed by using Ocitelloni test. Next one is a typhoid, or which is the enteric fever, which is the diagnostic by using a Widal test. And next one is the carcinogenicity. Such a type of the disease can be diagnosed by Ames test. So these all of the test, and next one is the next disease is which is the plague, and the diagnostic test performed for plague, which is the Western stain test, and program which control the plague, which is the plague control program, which control the plague. And last one, which is the vitamin B12 deficiency, which cause megaloblastic anemia. So such a type of the deficiency can be identified by using a Schilling's test performed for the vitamin B12 deficiency. So thank you friends for watching our video. Please like, comment, share and subscribe our channel. So thank you.